So treatment of food allergies. This is an area that's undergoing a lot of changes. So I would say to anybody who's thinking about this that the field is constantly changing and there's new information available. So the standard of treatment right now is strict avoidance of the offending food, and that's not always easy. We try to give information to patients and families about how to avoid foods. But labeling in foods is not very helpful nowadays. There's not a agreed upon industry standard for labeling. So a food may say this product may contain nuts or peanuts when in fact it does not. And that's why we try to steer families and patients to factual information that they can rely upon. One of the most helpful of those is a website developed by patients and families that helps them with understanding how to do good food avoidance. It's important in the child care or school setting that people caring for these children understand clearly what the child's reactions have been and are careful about looking at labels on foods when they are given to these children. Well, I think it's very important first that if a child is suspected of having a true food allergy because of the nature and the difficulty in making a correct diagnosis, that they should be seen by an allergist and have that evaluation. For all of our patients that are diagnosed with a significant food allergy, we recommend a food allergy action plan, is what we call it, which is a written plan of care that outlines what to do in the event that the child eats the food or develops a reaction. So it's clearly spelled out for the parents and for any teachers or other people involved in the care of that child. So I think a written food allergy action plan is a must that then can be worked through and agreed upon as the child care provider and the parents look at that action plan. On ours, we also include instructions on how to use auto-injectors of epinephrine as a reference for people so that they have that available. The vast majority of children who have food reactions, even severe food reactions, usually only react when they eat that food. There's a lot of concern about smelling an aroma or having it nearby causing reactions, and we generally don't see that. I think for very small children where it might be difficult to separate foods, that it would be good to have peanut-free or nut-free areas when a child with a food allergy is eating. That would ensure that they're not accidentally sharing foods. We also recommend having a food available from the parents that they know is acceptable if there's a sudden change in routine. A common thing is that it's somebody's birthday and their grandmother makes cupcakes and brings them into school, and the child with food allergies really shouldn't eat those because we can't guarantee that all the ingredients are safe, because sometimes grandmother's secret ingredient is peanut butter, for example. So in that case, we then can equip the child care provider or the teacher with an alternative food that was supplied by the parents that they know the child can tolerate. Then the child doesn't feel left out of the celebration but can safely be involved in it. And we think that kind of preventive thing is very helpful as well. And routine allergy shots do not work for food allergies. They've never been tolerated or effective. There are studies showing that you can desensitize some people by giving small amounts of the food by mouth, either as drops under the tongue or swallowing them in gradually increasing doses. These do seem to provide some temporary relief in the food allergy, but unfortunately are not sustained, meaning that we don't see long-lasting benefits from that. But I do think that research is leading us in the direction that we may have other treatments for food allergies in the future. So I think that's very important. And I also think it's an area in change and flux in that we may make recommendations about introducing some of these foods to much younger children. It turns out in the first 6 months of life, your body is much more accepting of outside foods and proteins than we may have understood, and that may actually reduce the rate of developing food allergies. So I would advise anybody interested in this area to stay posted because it's changing all the time.